Hello everyone, welcome to our February meeting for SNDA. Today we're having Miss Allison Junca. She's an Oncology Dietitian at Our Lady of the Lake.
I'm standing here doing this, so
You're good,
okay.
Wherever you want.
I wrote a few notes because I didn't know exactly what I should touch on. Okay, so yeah, I work at Our Lady of the Lake Cancer Institute. So it's basically connected to Our Lady of the Lake Hospital. It's just their outpatient clinic. So start off, I came to LSU, so I did 4 years undergrad. While I was here, I worked at a catering company, Unique Cuisine. It's located on Adlod Cook. Y'all may have heard of it. I worked with LSU Sports Nutrition for about 3.5 years. They were kind of still building up the program. So I started there. And then I worked at Pennington under Dr. Champagne for about 2 years. Then, of course, I applied for my internship. I got into North Oaks and Hammond. That was my first choice. And that was about 12 months long. I know you'll have to get a master's now, so y'all get that luxury. And after I finished my internship, I took my exam, and then I started working at Our Lady of the Lake inpatient. So I was doing clinical there. During the time they were using Morrison as their food service company, so I was technically employed by Morrison. And you'll learn about that if you're interested in working in clinical or in the hospital. It's mostly food service companies that are contracted through with that hospital. So right now, Our Lady of the Lake is actually using Sodexo. And I know Sodexo has an internship program out there. I don't think Morrison does. But yeah, I worked there for about 2.5 years. That's when COVID was extremely rampant. So I actually worked on the COVID ICU for a while. And then I had like a surgical floor, and I was in like a general medical floor there. During that time, well, I'll go back to my internship. So I got into oncology. I kind of knew that I really enjoyed it from my internship. I had 2 rotations in cancer. One was at UMC in New Orleans, and then one was at Mary Bird Perkins in Hammond. And I just really, really loved the dietitian and the relationship that they have with the patients and the staff. And everyone kind of thinks when you go into cancer care, it's kind of a sad place, which of course it does have, its sad moments, but for the most part, it's very happy because you kind of bring that joy to that patient while they're going through this really tough time. Sorry. So that was what really stuck out for oncology with me. But then of course, like going through my internship, I really loved all of my rotations. Kind of a weird thing to say because I know a lot of people kind of don't like some rotations, but there's none that I really didn't like. But yeah, I just had at the back of my mind that I loved oncology. But when I graduated, everyone kind of tells you to start in clinical first, which I don't think that's accurate, but I'll kind of get into that as my advice. So yeah, started oncology at the Lake. I've been in this role for about 2.5 years now. I really love it. I'll talk about my rewards with that. So of course, my coworkers, and that's very important working in healthcare, especially in the cancer setting. Your patients are coming back. Pretty often they're receiving chemotherapy, so you're with them through this whole cancer journey. So having that good working relationship with your infusion nurses, your doctors, your nurse practitioners, even your surgeons, it's really, really great. I can just, walk in a doctor's office at this point and say, hey, this person needs a feeding tube. And they'll say, why, Allison? Why do you think so? And they really appreciate my advice when it comes down to nutrition for the patient. They have really, that role is for me to do nutrition counseling with the patient. They don't try and take that over or anything, which is really great. It's really great to be appreciated in that way. And then and then of course with like referrals and stuff, it's really nice having the infusion nurses when they're starting a patient, starting their infusion. If the patient's showing any sign of, weight loss or side effect issues that's hindering them from eating, the nurses, they can just come to my office and ask me to see that patient. So it's really nice having that really close relationship with them. We also have a massage therapist. She massages all the patients' feet while they're getting their chemo. So if she hears anything in regards to diet, she'll come and grab me for any and everything. Love her. And then we have a social worker as well and some nursing navigators. So we all kind of work together just to really provide that good care for the cancer patient. And then of course, the biggest reward is the patients themselves. I was able to work inpatient and, now I'm an outpatient. So I've been able to see what it's like to work inpatient and working with the patients there versus outpatient. You get to see those patients again. So you do that nutrition assessment and then you really get to follow up and make sure that what you're going over with them is working. So you do a tube feeding prescription with them. And I'm the one that's in charge of that. Once you're inpatient, you do that tube feeding and then they might stay for a little while, but then they go home. So it's nice to just really build that relationship with the patient. They really, you gain their trust a lot. So on the level with a lot of patients where I'll walk up and they know who I am and they know what I'm there for and they just immediately, oh, I gained 3 pounds today. So it's really sweet just to have that working relationship with the patients. They're very, very sweet. They're very appreciative for everything that I do for them. Humble brag, but it's really nice. And then she asked about challenges. Of course, working for a large healthcare system kind of has its ins and outs. And being a dietitian, you're kind of on the smaller end of things. You're not a nurse, which is what makes up most of the system from what it looks like. So it's kind of hard to be heard sometimes. So with that as my advice is really, really advocate for yourself. Always advocate for yourself. And then, if you bring something up to your boss or just anyone in upper management, follow up. Send an email. I've kind of messed up a couple of times where I didn't send an email. It was more word of mouth and just trusted it would go through. But when you have it in writing, you can send that follow up like, hey, I asked about or told you I needed this done and it didn't get done. So I've had a couple of instances with my boss where, she's busy. She has a lot going on. So that's always important. Take notes, especially when you get to your internship. Just take all the notes that you can. All those dietitians you'll be working with, they specialize in that area. So you can learn so much from them rather than just the textbook and what you're learning here. You're really going to learn it when you're hands-on in the clinics, and then know your worth. So always, what's it called? When you're going for salary with the job, always argue your salary. That's like my biggest advice that I give to interns as they come through. I get a lot of brand new interns that come rotate with me, so I know y'all are not even in that area right now, but I just want to put it in your brains now. Just fight for that salary increase. And it works. So all I can do is tell you now. But yeah. Sorry, that was kind of...
So is your boss, are they a nurse or a physician or?
Yeah, she's actually a nurse. I can kind of describe my team that I'm a part of. So I should have brought my flyer with me. I'm part of the navigation and support team. So it's me, then we have 3 nursing navigators, and they are all divided amongst like cancer specific disease site. And then we have 1 social worker. I'm the only dietitian, by the way. And then we have our massage therapist, and then one social worker. And then above us is our boss. She is a nurse by trade, but she's just the director of all of us. There's not really a place where I fall under than oncology support. So it's a team of support staff, I guess.
Yeah.
But yeah, she's a nurse, so it's kind of a lot of education for her on what my role actually is.
So how many patients do you usually see, like, per day?
Depends on the day. It got pretty busy. I saw about 5. And I do have an intern right now, so I do a lot of teaching when I have a student, so it gets a little bit slower. I'd say an average of 5 per day. I've gotten up to like 10, 12. That's a very busy day for me. They're very high need when I do, any patients I do see, so I'm sitting with them for a while and there's usually a lot going on.
About the salary, like, would you say the appropriate time to start, like, kind of not arguing that, but speaking up about that?
Negotiate, that's the word.
Negotiating. Is that appropriate to do at, like, your first job, or do you, like...
Absolutely do that your first job.
Yeah, because I feel like it's, once you start, you can't really...
When you're a brand new dietitian, you're just wanting that first job, and that was me. But they're offering you, they have a pay scale where it's the lowest to the highest they can offer, and they're going to offer you the lowest. So that always, yeah, shoot for the stars.
Does anyone else have any questions? Okay, well, thank you for coming.
Thank you.
Welcome.
Or you can give it to her.
Okay.
Thank you. Thanks for emailing me back and stuff.
Thank you for coming.
Of course.
And if y'all need anything, y'all can email me.
Yes.
I love answering questions.
Allison will put your email in our little thing that we send after the meeting.
Okay.
Thank you.
Thank y'all.
Good luck. All right, spring membership dues. Once again, if you have not paid your membership dues, please do so.
You'd be surprised.
Volunteer opportunities. Cameron's not here today, but do check out the Google Doc.
Right there. She skipped class.
I'm sorry. I thought you were going to class in my head. Anything to say about this?
No, just keep checking it. I update it monthly, and I keep making the posts every month to spotlight like a unique opportunity that I find. So just keep looking out.
Sorry, Cameron.
That was it.
Okay. Be on the table. So once again, I mentioned this at the last meeting, but any ideas for National Nutrition Month, please send them to Dr. McKinley. Okay. The calendar. So don't forget about our give back night, and then this is the National Nutrition Month calendar with all the dates on it. So we do have the Easter basket drive coming up. So please donate to that. Dr. McKinley's making a Amazon wish list for that right now. So she'll send that out. And then we do have obviously the basket assembly. So if you can volunteer any hours towards that, we would appreciate it. And then don't forget about the LAND virtual meeting. It's free for all students, so please register. And it's the what day is it?
It's Friday.
It's this Friday and next Friday. Yep, first 2 Fridays of March.
So that calendar, just for those that don't understand, right now it lives in my files, but once March starts, a copy of it will be in the Google folder for the members to access, and you'll have a link to it, and I update it as stuff occurs. So you'll notice the end of the month is a little blank. That week after spring break is usually Ag Week, but I don't think that's occurring this year in the college based on recent events. So I will be on the lookout for things to add to the calendar for the end of the month, and I'll just keep updating it as needed. But if you're looking for stuff to do, there's stuff.
There's no Ag Magic this year.
No, there's Ag Magic this year.
Okay.
Yeah, I just put
There
it,
is,
it's the week of the 18th, I just put it once on there. Yeah. So sign up for that.
Ag Magic. Thank you for the segue.
Make sure you sign up.
Please sign up. If it's the same thing as it was last year, it's just explaining my plate to like various different age groups. It's pretty fun. Tiger to Tiger mentoring. Hannah, take this away.
For March, since it's National Nutrition Month, we're asking all the pairs to get together and do some kind of project relating to National Nutrition Month. So like you can get together and like make something like, I think, Kate, you guys did like a smoothie bowl
We
when you
did.
were a mentee?
We did pumpkin bars.
Pumpkin bars, you know,
Somebody
like
else
just give
did
them a
something.
recipe.
That's someone else did a smoothie bowl.
Yeah, or if you don't have the ability to make a recipe together, you can make like a little flyer or like an infographic, just something related to that, and share lots of pictures with us so we can show off on Instagram.
Oh,
Don't forget
and
to
track
track
your
your
meetings.
Pumpkin bars.
And the pumpkin bars.
There's the pumpkin bars.
Yeah, that's right there. I always use that picture.
That's the only one we have.
Everybody need pictures.
That's why I'm like, take pictures.
I asked y'all to submit pictures. Okay, so give back night at Andy's. Put it on a Thursday, so you know it's almost the weekend. So go get yourself a treat from 5 to 9, and then you do have to mention SNDA this year. Previous years we didn't have to mention it, but I guess they got smarter and realized
Yeah, I realized how much money we made.
and realized how much money they were spending. So we can receive 15%. So please mention it. All right, land. Already discussed this, but it's the first and second Friday of March, and it's virtual. So please register online using the link.
Yeah, there's when you go to that, it's the land website, but there should be a Google Doc for students to fill out since you don't have to pay anything. So fill the Google form out so that, and then you'll get sent the link. Or links. Yeah, the link for both days.
Or positions. If you'd like to run for a position and you are anyone under a senior not graduating, please apply for those positions. Just email us and then just say why you'd like to run for that position and then a picture so we can post it on Instagram whenever we do the actual election.
Do we want to talk about that one?
Yes.
Describe our
Describe
positions.
positions.
So, Corinne, tell us a little bit about what you do as president-elect.
So the president-elect just gets speakers and you send them an email and you tell them, or you ask them if they are willing to come speak and you give them information about our meetings. And we do a little with fundraising, but we just really provide our opinion. It's pretty easy. It doesn't take that much time, but then show some meetings and stuff. And then you become president next year.
So what do you do as president-elect?
So as president, I'm responsible for making the PowerPoints and communicating with the chairs for current events going on in the organization.
So we need a student that's either a freshman right now or a sophomore. So you need 2 years left to fulfill both of those years. So that's a very key position. One of the benefits of being president-elect is in your president year, we do fund you to go to Fancy if you want to go. So Corinne is taking us up on that this year so she can go and hopefully present some research, get that experience. So that is a very nice added benefit of being president.
Yes,
Think about
and then as president-elect, like you kind of see what the president in front of you is doing. So Corinne's getting all of the PowerPoints and everything, so she can kind of go off of that for next year when she is president. Okay, secretary or treasurer, you go.
I'm treasurer, so basically just write deposit checks, make sure everything with the bank account's going well. Yeah.
Secretary, you do the pre-meeting and post-meeting emails. You send like the pre-meeting email a week before. Just like, make sure you say like where and when the meeting's going to be, any important things we discuss. And then the post-meeting, I kind of just include everything that's in the PowerPoint. And then I take attendance. That's about it. Be very organized.
All right, so Dr. McKinley has our lovely SNDA merch out over there. Cameron is actually modeling our sweatshirt today. And then we also have t-shirts with that same design on it. We have lots of larges, so if you like a big sweatshirt, please grab one. Or please pay and grab one.
Yeah.
Please pay.
Make sure you
Please
pay.
pay.
We need the money.
All right, on-campus nutrition jobs. We talked about this last meeting, but the job that Hannah's currently working with Miss Sandra is up for a new student worker. So if you'd like to apply for that, please either email Hannah or Miss Sandra to set up a interview. And then the summer thing, you must be able to work over the summer. She can work with you if you wouldn't be able to work over the entire summer. Oh, these are the people who won the.
I put that in there.
Okay, so the DICAS and grad school application scholarship recipients are both not here, but it's Janique and Sydney. So congratulations to them. Woo! Member of the month.
And she's here, yay! Bonus points for being here. That's why you got it, because you come to meetings, and you've been volunteering a lot, yay! So I'll send you your certificate.
Thank you.
And we'll put you on social, so I'll get you connected with those gals. Yay! Thank you.
Congrats.
Meeting schedule. The last meeting is April 29th. Oh wait, actually it's in March.
Wait, what?
I'm sorry. We still have 2 more meetings, March and April. So our meeting for March is going to be on Zoom since our speaker is
She's
in
from
New Orleans.
New Orleans, and she did psych RD, and now she works with eating disorders.
Oh, okay.
Oh, how interesting. So that's why it's on Zoom.
Yeah.
And in April, that's our last one, and we'll have awards and a baked potato party.
That's right. We did ice cream.
Party.
That's fun. Potatoes. It's gonna be awesome.
I think that's the last one. All right, well, thank you for coming. Does anyone have any questions, comments, concerns?
Questions about positions that are open?
Yeah, anyone want to run?
Yeah, I know.
It's just
Donovan's
the
graduating.
extra little.
Are you
You just have to
graduating?
remember that.
You're graduating, yes.
I graduated this semester.
Tell her high water. I'll get it done for you.
Yeah, you gotta run now of your own volition before the Dr. McKinley starts. Beat down your door.
I can do it in my garden.
I'll do it from grad school.
Well, that's it. Thank you for coming.
If you
We
want to buy
appreciate
stuff,
your
let me know.
presence. Grab a snack, grab a water.
Maybe that's.
Please take snacks.